two, one. We're live. Episode 10 of World of Lifting podcast. We have Melanie Cen. She's part of Pittsburgh School of Health and Rehabilitation Sciences. She is a rehabilitation science major, third year, and a pre-PT student. How you doing?
I'm doing well. How are you?
Yeah, so we're going to kick this podcast off with why you chose this major. So why did you decide to choose rehabilitation science?
So in high school, I was never actually planning on going into any medical or health field. I was actually thinking of going into the engineering field. And
okay.
After some persuasion from my mom, she didn't really like the engineering field. She persuaded me to do something, at least something in health. And I kind of settled on pre-med. Like a lot of students, I planned on going biology pre-med my freshman year. And I wanted to specialize in oncology just because I had a friend who did have cancer. But once again, after talking to my mom, oncology didn't really seem like the right field just because I'm very emotionally oriented. And in oncology, you're obviously going to see people like pass away. You're going to form connections with the people who you take care of. And if I was in oncology, I don't know if I'd be able to handle the emotional load that it would put on me. So I thought, what's the next best thing? It's something that you can do afterwards, like after they're maybe not 100% better, but after they've recovered somewhat, you can help them return back to normal life. And that's why I chose PT, and rehabilitation sciences was something that Pittsburgh really specialized in. They had a program that normally sophomores apply into, but I was able to apply into it as a freshman just because I had enough credits and because I had really good mentors. I talked to my biology teacher, and she actually recommended going into rehab science my freshman year just because if I didn't get in this year, I could always apply next year. So yeah, that's how I got into it, basically.
So you said you're a very emotionally connected person in terms of this. So you made an example with your oncology. So is physical therapy the same? Like, is there like any bad injuries in your family that you want to take care of or something?
I don't think it's necessarily a bad injury or bad injuries in general. For me, it's more of seeing. So I'm of Asian descent, and people from like Asian descent or from like the East, technically, how they call it, don't really trust in Western methods, and Western methods can be like manipulation, like thrust therapy and like physical therapy in general. They don't really trust, or they don't know of that just because in the East they have different methods. They have like needling, which is like acupuncture, and then they have like cupping and stuff like that. So instead of doing like massage, or instead of doing like exercises and stuff like that, they would trust cupping and acupuncture more because they like have different ways of thinking, basically. And for me, I grew up not really knowing too much about like physical therapy. I do more of like the Eastern side because my mom and my grandma actually taught me how to do cupping. Like they didn't really. I learned how to do fire cupping when I was young, but I learned more of I think it's just like suction now.
Yeah.
So yeah, I really want to just kind of introduce or incorporate and mix like Eastern and Western methods of physical therapy, especially when I go into practice, and show like people of like my descent and your descent that it's okay to go into physical therapy. It's okay to start trusting it because there is like science behind it. There is like there's proof that it does work. And I want to kind of be like a familiar face for people of that culture to, start trusting Western medicine.
What part of Western physical therapy do they not trust?
I don't know if it's they don't trust it more than they're not familiar with it.
Okay, that's understandable. Because I know about the cupping, the acupuncture, and all that. I'm pretty sure that the Western side is learning that. I've seen because the PT office that you worked for, Well Health Physical Therapy, I've seen Annie do a lot of suction cup therapies.
Mm-hmm. Yeah, so the one that she does is more suction, and in the East, like more traditional kinds, it's like fire cupping, and like it's gonna sound weird, but like bloodletting, because they believe that there are like bad spirits like in the blood, and if you release the blood, then it would like in turn kind of help you more.
Wait, so they release blood?
Yeah, so there's actually I forgot where it is, but like there's a practice where they would like after like doing the cupping, they would prick your skin, and they would like let the blood go so that new blood can be like circulating within you, so that it's new and it's healthy, like quote unquote
Oh,
healthy.
so
Yeah,
the fire cupping will, any sort of cupping will get that area very red. So like I'm guessing that blood is the bad blood, and they
yeah.
just prick that area and
Mhm.
just let it out.
Supposed to like draw the bad blood to that area.
Interesting. That's
Yeah.
very interesting. So how do they apply the fire?
So basically, you have to put the fire within. They use kind of alcohol, and they put the fire within the cup, and they let the fire kind of just go. And then once they put the cup on the skin, the fire will start to like use up all the oxygen in there. And then once it does that, that's what pulls the skin into the cup.
Damn, that's crazy. Well, obviously now it's getting popular in the West. I've seen a lot of athletes, and especially on the pro side. One that comes to mind, Michael Phelps, in the finals, his back was completely like cupped, like it was showing there. So yeah, at least it's getting some attention here, even acupuncture. But yeah,
Yeah. I know in Pittsburgh, I talked to an advisor about like my goals in physical therapy and what I wanted to do, and she was telling me that there was a time when acupuncture or dry needling wasn't really like accepted in the physical therapy world, or if it wasn't like allowed. So now there are like set rules for acupuncture and physical therapy and like in different kinds of massage. So right now I think it's legal in all 50 states, but in certain states you need like higher certifications. You need to get a certificate of practice to be able to like to say that your clinic or your area has it or can provide it.
yeah. All right. So you are currently still in the process of becoming a physical therapist. That's what you want to. That's what you want to do, right?
Yep.
Physical therapist.
Mhm.
So what's the process? Can you describe the process? Because I would imagine it's pretty crazy.
So for any pre-health field, you kind of have to go into it with your undergrad major. It doesn't really matter which major you go to as long as you finish the requirements. So for me, like I said before, I wanted to do biology, and because it did fill a lot of requirements like biology, chemistry, physics, um, for PT school in particular, you have to do physics, bio, some chem, anatomy, physiology, and there are like little extra ones like on the side that you can take like as extracurriculars. So then after 4 years, or in my case 3 years, just because I am graduating early, 4 years of undergrad, you can go into a doctorate or major program for PT school, like a graduate PT program. So for Pitt, at least, I know that it has recently changed into a 2-year PT program where you can get your doctorate after 2 years. I think everyone's starting to move to 2 years instead of 3. And then after that, you're going to have to go into like residency where you want to specialize. And then you can either sign with a big corporation, like a big hospital, or you can create your own clinic. You can start doing research. There are a lot of different things that people can go into in terms of PT, because there's also a thing called like travel PT. I think that's where you sign with a company and you can like travel to different places after a few months based on like your schedule or what you want to do. And so yeah, I think that's pretty much
Well,
it.
the subjects you just named right now, were they prereqs, or they, is it like that's like part of the major?
For
Wait.
which ones, like anatomy, bio?
Yeah, yeah.
Yeah, those are all prerequisites. You have to do anatomy, physiology, you have to do biochemistry, physics before you apply to graduate school. Or I know certain graduate schools you can take the classes while you're applying. Like a certain number of credits you can take while you're still applying.
Okay, so you said undergrad is, in your case, 3 years,
Mm-hmm.
and so you're currently applying to graduate school.
Yes, I
So
will be
grad
applying in July or August, around that
so
time. That
graduate school would typically take how long?
graduate school takes 2 to 3 years.
2 to 3, or depending on how many credits you take, I guess.
Yeah, and depending on the program, because most programs they kind of have your classes set out for you. Like you take these classes this year, you take these
Oh,
classes
okay.
like this semester. um Pitt, I think, is doing 4 semesters per year, so that's 8 semesters within the 2 years. Before they used to do 3 semesters within 3 years, so then it was 9. So they did cut down a little, but they do have some benefits in terms of where you can like do a residency and everything like that.
So graduate school, is that separate from residency?
Some schools have it a part of their program and some schools don't. In terms of Pitt, residency is included, so that the Pitt's PT program, you can do your residency, like they move you around in different areas. Like I know one of the places I volunteered was Shadyside UPMC. So it's an outpatient clinic that's tied to UPMC, which is a major hospital in Pittsburgh. And one of the people who did their residency there told me that, oh yeah, after like a set amount of months, he was going to move to like an inpatient clinic or into like a geriatric area where he would see different areas just to like make sure where he's going is where he wants to go.
Wow. So the internships, those are also you have to apply as well because
Yeah, I haven't really done an internship because a lot of the people in my area were either PT techs, patient care technicians, or rehab aides. So like those are more jobs where you can get your clinical hours. I don't really know if we do too many like internships where you have to like shadow someone or like do that kind of stuff.
okay, so 3 years undergrad, 2 years grad school. So then once you get into PT school, is that an extra, what is that? Extra, another 3, another 4?
So your grad school is your PT school.
Oh, really? Oh, okay. Okay, so that's just 5 years, 5 or 6 years?
Yep.
Wow. And then you have, so I guess at the end, that's like there's a big exam.
Yeah. So different states have different tests to take to allow to for your licensure. I know some states like have the same test where you, if you take the test, you can practice in like those different states, but some states have like their specific test. So that if you take that certain test, then you can only practice in that state.
So in your case, are you going for just New York State?
I'm not sure about that yet.
Okay.
Yeah, because I'm thinking about staying. I'm in between staying in Pennsylvania and New York.
Okay. Why Pennsylvania?
I don't know. I think I've always just like liked it here.
Oh, yeah, that's right. You're in Pittsburgh. What am I?
Yeah. And I think
Okay.
it also depends on like which grad school I end up going to. So we'll see where I get into.
All right. So now we're gonna get into the juicy part of this podcast is what people really think of physical therapy is the rehab part of the process. So obviously you have a lot of patients coming in, different backgrounds, different walks of life, um, different a million ways to get injured. So let's talk about rehabbing a tear. So I'll use myself for an example. So I tore my labrum specifically. So in terms of anatomy for the shoulder, because I know shoulder injuries are also very common for lifters.
Mhm.
So how significant is the labrum for the shoulder?
I'd say it's pretty significant.
Yeah, I would imagine, right?
Yeah, a lot of lifters and a lot of people in general do come in with like labrum tears, like different like rotator cuff tears and stuff like that.
Mm-hmm.
Um, I'd say it's one of the more important just because it's harder to lift your arm like above your head, which is like in a pretty important like motion, especially even in like everyday life. Like you need to lift your arms above your head every now and then to like maybe put something back to reach something else. So I'd say like getting that fixed is really important just for everyday life. And once you're put back into a situation where you can be considered normal, strengthening becomes more important as an athlete to like help you get back to where you are so you can compete.
Yeah, because I heard a big problem with maybe on the older side of patients is frozen shoulder,
Yeah.
where they just don't move it after they're done with PT and everything, and it just kind of, I guess it's in the name, that the shoulder just basically just freezes up. It's just very hard to move.
Yeah, it just stays in that position. And then a lot of patients do end up having to come back to PT just because they don't practice like home, like their home exercises. And once you start not using a muscle, obviously it like becomes weaker. So then you're not able to do the things you were able to do in PT. And a lot of patients, sadly, like that does happen a lot, so that they keep having to come back to the physical therapist saying like, oh, what's wrong with me? Like, why isn't it happening? And it's just because they're not practicing at home.
Yeah, I don't like patients like that. They don't take the advice. But what this is actually interesting too. I've always wanted to understand us from a surgery standpoint. So for example, I tore my labrum,
Mm.
and I got surgery 2 years after the fact that I tore it. Just because I didn't want to get surgery for it because I was still competing, and I didn't, surgery to me was a last major resort for treatment. So in what case do you think surgery is absolutely necessary? Because I met a lot of athletes that have just lived on with a labrum tear, with like a Achilles tear, and they just live with it.
Yeah, so in terms of surgeries, there are a lot of studies out there right now comparing surgery versus like physical therapy, or surgery versus like different kinds of rehab methods. And it's really based on the situation. I think that surgery really helps to repair it faster rather than rehab, because rehab will take a longer time. And then if you don't keep up with the rehab, it'll obviously come back. It'll keep hurting and everything will get, not maybe not worse, but it'll stay at the situation where it's at. I don't know if surgery is always necessary, but I think it mostly depends on the situation. Like if you want to get better faster, like do you have an off season? Like you can do it during that off season while still practicing strength training. Obviously, you can't do that when you have surgery, but with rehab, you can kind of practice strength training while also kind of getting better.
Yeah, this is also the problem that I have with the medical field is I've seen a lot of injuries that are not even close to requiring surgery, but for some reason orthopedic surgeons they push it. It's weird because some of them they want to make a quick buck, some of them they genuinely want to help you, and unfortunately I've seen the side where they want to make a quick buck, like they want to push surgery because obviously they get a cut of that. They make money because they do the surgery. But yeah, I don't know. Have you seen that before?
Um, I don't think I've been in, I don't think I've experienced it enough to see it. I've definitely read different like research papers where a lot of surgeons will recommend surgery just because they do want to do that.
Hmm.
People who have like, you know, more integrity will not. Like those are
Yeah.
the PTs and like the orthopedic surgeons you can trust are the ones that like will ask you your feedback, like, oh, how quickly do you want to recover? How quickly do you need to recover in terms of like what you need to do afterwards? And
Hmm.
something that PTs worry about a lot is, I don't know if it's like a rule or just a saying, it's, are we so scared of like doing harm that we, or are we, yeah, are we so scared of doing harm that we actually do more harm to the patient? And it's like, oh, do we go ahead with surgery, or do we like keep doing rehab even though it might not like help them as fast as surgery?
Uh-huh.
And it's more based on like I said, like what the patient wants.
Yeah. So yeah, you're definitely right on that part, the surgery part. Because so let's see. So my specific, well, I'll use myself myself as an example again. My specific situation was I didn't know it was a torn labrum, but I knew something was wrong because of the torn labrum, I dislocated my shoulder like
Yeah.
literally a million times just from wrestling. And in my case, I decided enough was enough. I didn't want my shoulder to keep on popping out again, so I decided to fix it. And when they took a look at the MRI and they were like, yeah, your labrum's kind of messed up. So they did their thing because my surgeon was good too. He didn't push the surgery on me. He was like, bro, you can leave this alone, you know, but I'm pretty sure you'll be back. So you can do what you want, but surgery is, you know, is your choice. So I was like, yo, I want the surgery. So I decided to schedule it like a month ahead of time. And then, yeah, so I did it. But let's see. So I would imagine the most common areas for injury for athletes, um, shoulders, and we got like some like knees. I would imagine Knees are very common
The
nowadays.
knees are really common. Knees, just because like a lot of people like do run, and
Mm.
it's a lot of load bearing. So it's like a lot of it's gonna be like just wear and tear on your knees, which is gonna like a lot of it is just like tendonitis, which is gonna be like a lot of just rubbing against joints and everything like that. And also like the same thing with the shoulders. And then you also see some injuries in like the elbow with like tennis players, just because like
Mm-hmm.
they'll have like tennis elbow, just because the motion there keeps happening. So yeah, shoulders and knees are definitely a lot. I know for me at least, I was a swimmer in high school and I actually have tendonitis in both my knees and both my shoulders just because of like I would keep overworking my knees and shoulders, and I also didn't know that I was doing certain strokes wrong up until like a certain point when I like entered high school when I actually started like professionally swimming. So like I was doing more damage on my knees than I knew I was. So yeah, like you see it a lot in different kinds of athletes.
That's interesting. I thought swimming was like a non-weight bearing sport because just it's definitely hard when you're competing. But wait, do you still have tendonitis? And
So tendonitis is it kind of comes back like the more you work it. So like it'll go away, but it can obviously come back. For me, when it came to swimming, I was just doing things wrong. Like I did certain strokes wrong. I
it's
did,
just like a motor pattern issue, right?
yeah. So when I did breaststroke, like that's where it really hurt my knees, just because I always kicked a certain way and it was wrong, but no one really ever corrected me, and that kept rubbing my bones the wrong way, like my joints. And because of that, because my joints kept rubbing together and like wearing me down, when I started to like actually compete with that stroke, like it actually started like wearing it down more and it started to hurt. And I just kind of ignored it to the point where I was like, okay, might as well just not do that stroke and I'll just ignore it and I'll do it only when I need to, like in practice. Yeah.
So was there ever a technique fix that fixed it? Like you didn't have any more inflammation?
Yeah, a little bit, I guess. My coach in high school, like kind of midway through like my high school career, he started realizing that why I was avoiding breaststroke. He was like, you're kicking wrong, right? And I was like, I didn't know. And
Okay.
then after that, like it started to get easier, but obviously like the damage was done and my knees kind of were like shot. So like I just avoided that stroke, but I kept trying to get it to the the right way to do it, like quote unquote the right way to do it as possible, just so I didn't do further damage.
So you have knee you when you had knee tendonitis, was it like a patellar? Or was it
Yeah.
like it was patellar tendon?
Mm.
That's strange. I've never heard of a swimmer that had knee tendonitis before. That's a first for me. I never heard of that.
Just because you swam wrong.
Yeah, I never knew that. Well, I understand the shoulder part. I've heard people that dislocate their shoulder doing a backstroke,
Yeah.
and that kind of freaks me out. I was like, what the hell? Just that angle, just
Mm.
going back, and
Especially when
yeah,
you're going like at fast speeds, like it's also kind of easy to like just dislocate. Yeah, when it dislocates, because it'll
mm,
just like pop out, and then sometimes people don't even like realize it when they're trying to swim so fast. They're just doing it to get the race over with. For me, it was more. I heard it during butterfly, just because.
shoulder. Oh yeah,
Yeah,
definitely butterfly. Yeah.
yeah. So then afterwards, like after I realized like butterfly and breaststroke both hurt, I just stuck to like freestyle and backstroke.
Oh well, at least you did well. You're considered a pro swimmer. It's freaking crazy.
I don't know about that.
I mean,
Just
that's
did
like
well
that.
enough and on the team.
Okay. Okay. Well, we're talking about sports already, so um, let's see. So the most common injuries I've seen um, from sports aspect, American football, um, wrestling, a lot of the combat sports, weightlifting. You get your fair share of injuries, and then oh, the ball sports, definitely like basketball and all that. So let's talk about the other body parts for injury. So we talked about shoulders and knees and elbows, but we never talked about the arm. Like when we talk about the bicep, the tricep, forearms, a lot
Yeah.
of people I've seen they have bicep tendonitis,
Hmm.
and I actually don't know how this happens. So do you have an explanation for this?
So with bicep tendonitis, it's like basically like more overuse, and I think with that, because the bicep has two heads, so
Hmm.
it kind of crosses like different joints also. So it's like different when you overuse certain joints, it'll just create more friction, and that friction will just induce tendonitis.
So by definition, tendonitis is it is it like the rubbing of bone? Like what is it?
So tendonitis, so tendon, obviously that relates to tendon, and itis is just inflammation. So it's inflammations of the tendons.
Okay, so not the actual bone. It's just
Yeah.
okay.
But rubbing a bone can like induce the like inflammation, just because it'll like either press on it or like it'll just make it inflamed.
I feel like if you're rubbing on bone, like I feel
Because
like your
bones,
cartilage has gone away.
yeah, that's another thing too. Is when because the cartilage acts as like a buffer or just like a
Like a padding.
yeah padding for your tendons to like when they connect and everything like that, or like when they attach to your bone. So like once that padding kind of goes away, it's easier for your tendons to become inflamed.
Hmm, that's interesting. All right. That was definitely interesting. I didn't know about that. But so then we talk about the during my time in PT, I have never seen so many people getting treated for back injuries in my life ever. So I recently had another guy on the podcast like 2 weeks ago. So he has something called, if you don't know, spondylolisthesis. I think that's what it was called.
Mm-hmm.
And he's like he's up there for powerlifting. He's very strong. He's used lifting as a rehab
Yeah.
for his back. So I think he told me he has 5 herniated discs um, back from when he was a kid, and he started lifting properly, and it started to rehab his back as he was able to form more muscle into that area.
Yeah.
So um, so for a herniated disc, what's the rehab process for that?
For that, I think it's more like seeing where or why you herniated, or like start you can start from there, like why it started to become like that, like why your
Hmm.
disc became herniated, and then just trying to correct that to correct your posture. You're trying to correct like why how your spine is. So like in terms of powerlifting, obviously it's a lot of like load bearing on your joints, and
Hmm.
like it's going to create like more rubbing against that. And so I think if it's obviously you said, like once he started to lift the right way, it started to rehab his back. So it's
Hmm.
like once you see what the problem is, you can correct it.
Yeah. So because I heard this is a weird part because the problem with America now, obviously we have a very high obesity, and we have a lot of people that are very sedentary,
Yeah.
and this lockdown is definitely not helping it. But
Mhm.
I've heard people that continuously sit, like in an office job, it herniates their lumbar, and I was like, what the hell? Like
Yeah.
just sitting, I guess, like you said, posture. It
Mhm.
eventually just like, I get the herniation is like the gel, right, in that spine area. It just like it comes out.
Yeah.
Yeah,
So if
and
you're sitting the wrong way and if it's like overly done, it can actually like it'll cause that like gel to kind of come out.
so a herniated disc, does that ever require surgery?
I'm not sure.
Oh, you're not sure? Oh, okay.
Yeah, I think I need to do more schooling to find out.
Okay, that's fair. But yeah, most definitely during the PT period of time where I was, back injuries were very very common. But to treat, I think regular back pain, I've seen Annie do they start off with the heat, do like a contrast, heat cold.
Mhm.
Um, I think do they do cupping for back
It
or
depends
acupuncture?
on where in the back, but I know like when you're up in the cervical area, they often do it just to like relieve tension, because a lot of the time when it is cervical, it's more because people are like slouching over and they want to relieve tension in your shoulders kind of also. So it's like it'll relieve the tension there, and it also help it become easier to fix your posture.
Yeah, most definitely. All right. Let's see here. So you directly told me that you wanted to become a physical therapy. So
Yes.
are there any specific goals that you have in it besides the fact that you want your family to trust it more and to get more and more like in touch with it?
I think for me, there are different ways that I could go. And I've thought about, like, I've considered a lot of different situations. I don't know if it's going to change after I do more residency, but I would do orthopedic, or I would also want to try oncological, so like cancer rehab. It's a,
Physical therapy?
yeah. So
Oh, okay.
after people do like chemotherapy and everything like that, after like the tumor may like be gone or maybe not be gone, like they will often go through physical therapy to kind of just get their muscles back to where they used to be at from like before the tumor started to grow.
Wow.
And it's also a it's a difficult field just because there are certain things that you can't do, like ultrasound. You can't really ultrasound a place where a tumor was because you're not sure if it can cause it to
Oh
come back.
God, yeah.
Yeah, and if someone still has cancer, there are certain manipulations I think that are not recommended to do just because it could cause more blood flow to that area. It could cause the tumor to grow more. It could cause the tumor to grow faster. So that's something I've like considered doing. And then I've also talked to a lot of the teachers. So a lot of the teachers within the rehab science program are practicing PTs, and they're also teachers within the PT graduate program. And they've told me that after you've done physical therapy for a few years, a lot of them will want to go into research, or it's like kind of a next step is to go into research just to kind of find more out about PT because there's always something new coming out. There's always something that can be applied. There's always new machinery that's being applied. So yeah, like those are the kind of the different routes I've looked into physical therapy.
Have you ever thought about opening your own place, like your own practice?
Um, I think I don't know if I have the confidence for that right now,
Okay.
but I've thought about it. I've thought about opening a clinic and kind of getting it started, and then after that, maybe after like 10, 15 years, start to like hire more PTs, like start to collaborate more with the other PTs, like hire PTs so that I would do more like administrative work or just like managerial work so I could focus on research because I would want to do more research on like what science there is behind like Eastern methods.
Oh, specifically Eastern methods.
Yeah.
Okay, let's talk about that. So it's, part of it is needling, right? You said acupuncture.
Mhm.
So is that part of your schooling? Are you ever going to learn how to do that?
No, so not within like the rehab science program, or I don't know if I would learn it in PT school just because it's a completely different like licensing like kind of thing, and you need different schooling for it. And you need a certain number of like experience, a certain number of years of experience to get like a license in acupuncture.
Oh
Um,
wow.
I definitely do want to try to get that just because I want to learn more about like acupuncture and why that like how it helps and everything like that. I've also considered like before PT, I also considered like chiropractic,
Oh yeah.
but so with that, it's not really like a lot of PTs and like medical doctors don't consider a chiropractor like not a medical necessity, but they don't consider them on the same level just because it's like the science behind it is kind of iffy.
Chiropractic. Oh yeah, because there's a lot of cracking. That's what I've seen.
Yeah.
They manipulate areas where they just I guess release gas bubbles. I don't know.
Yeah.
I'm not sure
So
about it either.
a lot of the cracking is just like, yeah, releasing the gas bubbles. So physical therapists, some of them do like thrust, and then that also helps to release gas bubbles, but not really too sure if you can kind of equate like a physical therapist and a chiropractor, which is why I kind of like put that off to the side. But I would also want to do like more research because there is not a lot of research on chiropractic either. So I feel like I would, if I were to do any more research, I'd want to do it on that kind of stuff.
Okay. All right. Let's talk about where in your area where you worked with do we call her Dr. Annie?
Yeah.
Yeah, we do. Okay. Okay, so that Dr. Annie, so she owns this clinic called Well Health Physical Therapy. That's where I got treated for my post surgery for my labrum tear.
Mm-hmm.
So how would you describe your experience there?
I think I learned a lot there actually. I learned a lot of like how because it was the first clinic that I've ever really been to. Like I've seen inpatient clinics for physical therapy, but it's pretty different when it's like an outpatient clinic. You're not really like looking to see like what the doctor says. You're not really doing too much of that. I learned a lot of different like application based physical therapy. Like she taught me how to like mobilize certain muscles. She taught me how to like help a patient with like lumbar pain, cervical pain, like foot, ankle, everything like that. I also learned a lot of how to do the correct exercises and how to target certain areas when you do those exercises. So I'd say that my experience at Well Health Physical Therapy really helped me to learn more about physical therapy and kind of also helped me learn more why I like it. Because
Okay.
seeing all the patients and interacting with the patients really did kind of make me see that this is a field I really want to be in.
That's definitely interesting because so when someone gets injured, obviously it's definitely not a happy place in their happy time in their life.
Yeah.
And what I've noticed is Annie's always very, very cheerful, very happy, very, very positive. And that definitely helped me during my period of rehabbing my shoulder because that was definitely like a horrible, horrible time. That was like because I couldn't do the things I wanted to do. And Annie was like, yo, you get back on track. You're fine. She's always cracking jokes. She's always making me laugh. And I feel like that definitely helped the mental aspect of like interacting with your patients. Do you think that sort of attitude like definitely helps patients?
Yeah, for sure. Physical therapy, I've talked to Annie about this. Physical therapy is as much as that as it is like mental therapy.
Oh,
Whenever
interesting.
whenever a patient comes in, she'll always make sure to talk to them like she really cares because she really does. And I think that's actually like one of the most important aspects of physical therapy is the fact that it is like personal. You start to learn about the patient like on a personal level. You start to learn like about their background, about like how this happened, how different things are, how it's affecting their life. And
Hmm.
like once you've learned how it affects their life, you kind of it doesn't not it's not like it takes a toll on you, but you start to like sympathize with them. You start to understand like where they're coming from. A lot of people when they
Like you
come
form a connection, kind of.
yeah, they come into a clinic with pain, and a lot of people don't really understand that they might be rude because they're in pain because they can't like do certain things that they want to do.
Oh,
Yeah, and it's an interesting thing when you can see like a patient's mood definitely change like from visit to visit just because you can see them getting better. You can see them start to feel better as a person, start to feel better like with their situation. And talking to them definitely helps. A big part of physical therapy is while you might want to tell them like, oh, everything's going to be okay, you're going to be back on your feet soon, you also have to be realistic with them. Um, and understanding that part too is really important because you don't want to promise them false hope. You
oh
don't want to
God,
say
yeah,
like, oh, you'll be done like within a week, because that's a lot of the times that's not going to happen. You have to tell them like, oh, it's going to be a hard journey, but at the same time, you're going to get better. You're going to come out of it stronger as long as you like follow what we have to help you with. Yeah.
yeah. I definitely noticed that. I think, yeah, I've definitely seen Annie pick her words very carefully, especially among the patients that I've seen that have gone messed up. Well, not messed up, but like they've gone through extensive surgery, like a knee replacement. Uh, and I remember this one guy. Like, she was stretching it in the is it flexion
Mhm.
where she's just bending it. I think it's flexion, right? Just to be able to get that range of motion. I've never heard someone scream so loud in pain, just because of the free, I guess the scar tissue buildup or something. But yeah, like damn, that guy was in pain, and like I guess he was talking about like the I don't know if I'm allowed to talk about this, but he was talking about the after like recovery and all that, and I've seen her like she's very careful of what he told him, and yeah, that definitely sucks because it's not something a patient that's not something a patient wants to hear. Like they definitely want to get back on their feet and whatnot. But yeah, it definitely sucks hearing from a doctor, oh, you can't do it again.
Yeah.
But yeah,
It's like you don't want to promise a patient something that's not going to happen because one, it'll hurt your reputation as like a physician. It's going to show them that like, oh, why isn't it getting better? They're going to start asking questions like, oh, you promised this, like why isn't it happening? You want to, especially as a physician, you need to really be careful with your words just because if it doesn't turn out the way it's supposed to, you either need to back it up with like a why, or like why you said something, and you can't just say like, oh, I said it to make you feel better.
Oh, damn.
Yeah.
Wow. I never
That's why
thought
you
about
always need
that.
to pick your words very carefully. You have to understand the truth, and you need to let your patient know that what the truth is, but also showing them that there could be like a brighter side.
Okay, so yeah, yeah. So let's say like a patient like gone through some really messed up knee injury, like repeated ACL tears or something,
Yeah.
and and they can't get back to playing the sport they want to play, but they keep pushing for it. Like, what do you what are you as a physical therapist supposed to tell them? Like I don't know, is it like direct, like, oh, you never do that shit again, or like, oh no, you'll slowly get back. Like, how do they pick the words? That's definitely very
I
interesting.
don't think it should ever be as direct as you just said it right now.
Oh, okay.
But I think, at least for me, I think being as honest as possible is important, and telling them that you may not be able to go back into that sport just because like of these repetitive tears and because of like all the injuries you've been through. Like you will need to take time like off from a sport if it's like repetitive. Like you will need to take time off to like get it repaired, to like help fix it back to where, maybe not back to where it used to be, and you need to let the patient know that you may not be at where you used to be, but doing the best you can is like will have to be like the best case scenario.
So I guess it's also the way you portray it, because
Yeah.
obviously, yeah, I gave a bad example earlier. They'll never do that shit again. But
Mhm.
yeah, I guess that's definitely play into the mood of the patient. But yeah, I remember seeing God, this is so depressing. This high school soccer player that was in the clinic. I don't know if you remember him, but there was a soccer player in there. He was a high school soccer player, and I think he tore his knee. So some ligament, I forgot which one.
Mhm.
But this guy, he was in crutches, and he was near the waiting area. This guy was crying. Like it was so sad. I was like, man, I feel you, man. Like I can't wrestle anymore. But yeah, there is yeah, it's definitely like a mental aspect of like physical therapy.
Yeah. And
Yeah.
that also could be kind of like a placebo effect when you kind of go into it with like, when a physician goes into it with a positive mindset, letting your patient know that, oh, it might be okay, it's going to be okay, or like, because when you start to think that you're going to get better, it could really take a toll on you. It's good, and it could actually help you believe that you're going to get better, and it's going to help trick your body into actually getting better.
Oh, that's interesting.
Yeah.
So
So
like,
as long as you have like that positive mindset of like, oh, I'm going to get better, it may actually help you.
do you feel like Annie's positive vibe could rub off like onto the patients? Because I've seen patients that are like they're so depressed, they're like tired of it. Like this lady just kept complaining about her hip, I think.
Yeah.
And yeah.
Yeah. I think that's the way most physicians should be. It's like have a positive attitude, because their attitude really does reflect on like everyone else in the clinic. It's going to reflect on the like the people at the front desk. It's going to reflect on the patients, because if the physician isn't hopeful of like your recovery and like anyone else's recovery, then why should you? And then once you start getting down on yourself, you
Oh,
start not wanting to do rehabilitation anymore. You might start not wanting to like come to your physical therapy appointments, and you might not see any point in actually getting better.
okay. So let me kick you a scenario. So
Mhm.
let's say someone walks in with a specific injury. Let's pick let's say ACL tear,
Mhm.
and they recently just repaired it, and they walk in with crutches, and they walk into to your office, and they're like, okay, I just finished surgery, and I'm supposed to do physical therapy. So like, what is like the beginning stages of like a rehab process, like with an injury like that?
Um, well, we have to fill out intake forms and like insurance and obviously all that kind of stuff.
Oh yeah.
But I think from my point of view, the most important thing is having that one-on-one time with the patient, and also looking through their like x-rays and everything after the surgery, like how it may be healing, or like where the tear was, like where specifically in the tendon the tear or the ligament where it was.
Okay.
And like also assessing the situation, like because there are certain like exercises that you can and cannot do with a certain kind of tear.
Okay.
So you need to like, there are obviously some boxes that you can that need to be checked off with certain tears, but there's never going to be like, oh, this you have to do this and this to get to back to where you are. It always depends on the person.
Yeah,
But
it's
physical
individualized.
therapy is very much like specialized for the person because of like their situation. Because an ACL tear like in a soccer player may be different from like an ACL tear within in someone who like has a desk job, you know, because they may just need to like walk from place to place versus like a soccer player needs it to get to go back to their job, to like go back and play soccer.
Interesting. Yeah, Annie talked about that with me too, because let's say I was making very good progress in the rehab process, and it was like very quick,
Yeah.
and she was like, she's like, okay, you gotta chill, because you're not going back to a boring desk job. You're going back to freaking like competition lifting. Like it's not a bad idea just to stay a little bit longer and just like rehab it a little bit longer. So she it's definitely not cookie cutter. It's definitely like there's like
Yeah.
specialized programs. Yeah, definitely.
Yeah, because if you have to go back to a sport, you don't want the tear or whatever to happen again, obviously. And
Yeah.
you're in a situation where it's more likely that it will happen again. So it's so with physical therapy and with rehab, it will take a little longer for someone who's in like who's doing sports rather than some
Mhm.
like a normal like a person who's doing a regular like office job.
All right, let's talk about this freaking this pandemic that's been going on, COVID-19.
Hmm.
So obviously, almost every business that you can name has been shut down. And has physical therapist office, are they considered essential?
Yes, so I think they were deemed essential, but it's also up to the PT of if they want to keep their clinic open or if they want to do what we call telehealth. And it's basically just like giving the patient like one-on-one time over like Zoom, over a Skype call, over like just online in general. So telehealth hasn't really, it's been used more in like rural areas just because where PTs may not be like abundant, where you can't just go to a PT office like
Okay.
in a simple time span. They may be like 2 hours away or something like that. So telehealth has definitely been used more now during this like pandemic, just because there are still patients who need to recover. And if they can't go back into the clinic, then telehealth's like the next best thing.
Because I read something like a few months back that I think chiropractors were also considered essential. So I was wondering if it went in with the same category as physical therapy, like they decided to open it up. So in Annie's case, are they open?
Annie right now, she's doing telehealth.
So she's not open.
Yeah.
She's just doing over Zoom.
Mhm.
Huh.
Yeah. And with telehealth, it's actually pretty interesting the way that it's going, just because telehealth never really was defined too well, or like what telehealth is and like what people can do or can't do over telehealth is like not really defined well, because it's like we said, it's based on the person and like what they need. And there are a lot of different hurdles that people and different PTs need to jump over to do telehealth nowadays, just because with this pandemic, like a lot of different insurance companies are releasing different programs or different things to allow patients to have like telehealth visits. And with that, because obviously like PTs need to be paid for their time when they do those kinds of visits, it's
Hmm.
hard to quantify how much, because you may not be getting the same treatment, because obviously physical therapy is very like hands-on, and telehealth you can't have like manipulation like from them. You can't have like thrust manipulation, can't have like massage therapy, you can't do manual therapy, different stuff like that. A lot of it is going to have to be online. Like you have to, they're going to they can teach you the exercises and they can critique your exercises, but it's very different.
Yeah, most definitely. So in your experience, have you had to do that yet?
No,
Like
not at that
like
level.
helping out like a physical therapist, like with a Zoom thing. Is that a thing?
No, I haven't experienced it yet. I'm not sure if I will before I go into grad school, but right now I'm doing more research. Like I'm helping a PT with her research right now.
Okay, so obviously in telehealth it's very limited on what you can do. So
Mhm.
if there is a patient that has like a injury that needs massage therapy or like hands-on kind of thing, like well, what do they how do they is there like a way around it? Is there alternative things that they can do?
Um, there might be. I'm not too sure, but it could also just be between the PT and the patient because if the PT understands the situation and knows that like, oh, they're healthy and they reassure that the patient that they're healthy and that the patient reassures the PT that they're healthy, the PT might do like a home visit and actually do like that manual therapy with them.
Yeah, because I know Annie has I remember she had a lot of patients. So how do they schedule appointments? Because I don't know if it's not is it like it's a one-on-one call, right?
Hmm.
Okay.
Yeah, so with that, it'll be more giving them the exercises that they need to do and trusting that they do the exercises on their own or maybe having them do shorter calls than would be then it would be translated into like in office.
So it's just like a check-in.
Yeah, check in and then like if they have questions or they Annie might ask like, oh, can you do this exercise and show me like how is it like how are you doing it, everything like that, like how you're feeling. So yeah.
All right. Well, that's basically everything I needed to know from you. But now we gotta go into the real part of this podcast is the lifting aspect of rehab. Because this is a lifting podcast,
Yeah.
and I want to provide the listeners with some good knowledge. So the most problems I've seen in terms of my sport, powerlifting, mainly is let's see, really horrible technique, which leads to back issues,
Mhm.
and I've seen a lot of tendonitis issues,
Yeah.
which stems from I would imagine like poor motor patterns. But so let's say I get tendonitis in my knee.
Mhm.
Uh, what would you say is like a good protocol for a tendonitis in the knee?
A lot of it would just have to be like stretching, strengthening, stuff like that. Like checking why you have tendonitis. Like, is it form? Is it like just overuse? Stuff like that. Because then it would also you could also start applying different things. Like people do use like KT tape,
Hmm.
but help keep like tendons and everything like in place. So like starting to use those and starting to use like knee braces and like different braces like that to keep your bones and everything like where they're supposed to be while you're going through motions is also helpful.
Okay. Okay. So another problem is okay. So we went through the knee issues, the back issues. So back issues, a lot of times I've seen lifters use belts as a brace
Mm-hmm.
and not as like a lifting tool.
Yeah.
So they have back pain and they're just okay. I'll slap on a belt just because it'll make me feel better. And from a lifter standpoint, I don't think that's very smart. I feel like you need to find the issue on why there's a back pain in the first place. What's your take on that?
I think the brace kind of addresses like one problem. A lot of the problem, I think, with powerlifting, something that people fail to do is like stabilizing their lower back, like
Hmm.
stabilizing and kind of understanding that like a lot of power does come from the trunk and that you need to strengthen your core just as much as you need to strengthen like everything else.
Yeah,
So like
bracing.
yeah, so that's why they use the brace. It's because they need to like keep their core intact. They need to keep their posture correct, and that's what the brace really does for them. So a lot of the times, like if they don't want to correct their own posture, like having the brace correct it for them does help a little bit. But like also they need to understand that you need to strengthen that area and you can't keep using the brace for
Yeah,
that.
yeah, definitely don't use lifting equipment as a crutch. It's not. Yeah, it'll only lead to more problems as the weights get heavier. I would
Yeah.
imagine. All right, so let's see. I think about it. Powerlifting, we addressed the knee, Did I address shoulder?
Not
No.
yet. I don't think so.
Shoulder. Let's see. The only problems I've seen, well, because my injury wasn't really from lifting; it was always from wrestling. But
Yeah.
uh, let's see. I've seen. I know lifters that have partial tears
Mm.
in, let's say, from a heavy overhead press. They're straining, and sometimes something can go wrong. There's a little pop in there,
Yeah.
and it starts swelling. So, what's the protocol for something that's swelling, like a shoulder?
With that, first, I think it's always like ice,
Ice.
especially if
Okay.
it's swelling that you're not sure like what happened with it. Ice, and then getting it checked out, and then seeing like what happened.
Like taking it through the range of motion and whatnot.
Yeah, like can you still lift with that arm? Can you like lift your arm at a certain degree? Like, yeah, do you have like decreased range of motion? Do you have like decreased strength and everything like that?
Actually, that's interesting. In what situations would you use heat? What situations would you use like an ice therapy?
I'm not too sure.
Oh, really? Okay.
Yeah, I'm not too sure, but I know ice will like just help decrease like inflammation, while like heat will obviously bring more blood to that area.
Wait, ice will bring more blood to that area?
No, heat will,
Oh,
and then
heat will. Okay.
ice will like, kind of like stop. I mean, not stop,
Stop.
but it'll like slow it down so that
Yeah.
swelling will go down, inflammation will go down. Yeah.
Okay. So that's fair. All right. Powerlifting. Let's see. So we have, let's see, bench press. A lot of bench press injuries I've seen is the classic pec tear, and that'll that'll definitely throw you out of commission for a while if you
Yeah.
get a legit pec tear, like a separation from the, I think from the shoulder,
Mhm.
like the tendon.
Yeah.
So obviously they have to go through a surgery and all that. But I've seen lifters use like acupuncture therapy for a minor tear.
Mhm.
So do you think that's a good situation to use like acupuncture, like a pec injury?
I think acupuncture can really be used like in anything, really, because acupuncture can relate to a lot of small and big problems. Like it help relieve tension, help like, because I know people even do acupuncture to like relieve stress, like mental stress and stuff like that. So I think acupuncture can kind of help everybody in some way.
Okay. But taking it through that, let's see. So the pec tissues, they run from the shoulder, like, is like in a diagonal kind of way.
Yeah, kind of.
So I think some also treatment I've heard is like the scraping therapy.
Hmm.
Like, I don't know what it's called. Is it called scraping therapy?
I think it's scraping. I'm not sure.
Yeah. So I think they use this little tiny metal like comb looking thing, and they just try to get blood flow in that area. They just keep scraping that area.
Yeah.
Yeah. So have you ever had to, like, do you think that's useful?
I think it's useful just because like it'll help like bring blood to the area, and obviously like the more circulation that there is, it'll help rehab more kind of, just because like with like the red blood cells, they're having more oxygen to that area, and then repair is kind of quickened.
Okay. So let's see. So we talk minor pops, minor strains like tendonitis. So
Mhm.
you said ice, that's good for the swelling.
Yeah.
Tendonitis, crap. Is tendonitis? Do they use ice for that?
Yeah.
Okay, so ice with tendonitis. Um, and then obviously if there's a pop, you said just check it out. Peace of mind, stuff like that.
Mhm.
Let's see. We talked about back injuries. Talked about. Oh, yeah. Another thing that a lifter would get eventually is from pressing movements is the classic elbow tendonitis. So I'm imagining that's like the same protocol. Get some
Yeah.
cold in that area.
Hmm. And then like I said before, it's like not always like cut and dry like one way or the other. Like ice will not always like help it. You need to go into like rehab,
Hmm.
and you also will need to rest it, just because with tendonitis it'll always like come back and it may just get worse. So yeah.
What's your opinion on CBD products? Those are getting big.
Um, I don't know. I haven't really done too much research on it, and I haven't really looked into it too much. So I can't really say anything on it on the matter.
But yeah, I've seen a lot of lifters, they use it for their inflammation and they say it works great. Like,
I think once people do their research on it, if they trust in a product, anything could, then I feel like a lot of the time when people go into like, I'm not saying like CBD is a fad, but like a lot of people like will go into like things to make pain go away faster.
Ah,
Yeah. So, cause that's what, cause there is like not a crisis, but there is a problem with like prescription medicine. Like doctors will often prescribe medicine instead of having them do like different things. Some doctors will prescribe like pain medication instead of like rehab, just because it may be easier or something like that. But I think medicating isn't always the best.
yeah, most definitely. Like they'll give you because after my surgery they gave me oxycodone,
Mm-hmm.
and obviously America we have a very big crisis with opioids,
Mm-hmm.
and I was terrified of using them like after surgery because I knew because they told me like after the numbing effect from my arm goes away that there's gonna be pain, and I was
Yeah.
like, damn, I don't want to use the oxy. So I
Mm-hmm.
the pain came, and I think I died for like 2 days straight before the pain went away. But yeah, the pain medication is definitely yeah they use that as a crutch as well. I
Yeah.
guess like oh just take this and you'll feel good.
Mm-hmm. Yeah.
But yeah, that's basically all I wanted to ask for the powerlifting section. I don't know if you have any questions for me.
Um, Not really.
Not really. All right, we covered everything.
Yeah, I mean, is there anything that you would want from a physical therapist? Like, what is your ideal physical therapist?
Oh,
Help powerlifters in general.
that's actually a great question. Okay. Wait, so you said what would I look for
Yeah, in
in
physical.
terms of
Mm-hmm.
well, I would want a physical therapist that has extensive knowledge in lifting, particularly
Mm-hmm.
because I've seen physical therapists that that don't know the mechanics of a squat, a deadlift, or a bench press, so they
Yeah.
kind of prescribe the wrong kind of movements
Mm-hmm.
for the rehab. Not to not to to roast Annie or anything, but like I've I've seen her. So this guy, I think he had a knee issue, and
Mm-hmm.
she was making him do squats.
Yeah.
I'm sorry, Annie, but those were the worst squats I've ever seen in my life. And just kicking it out there is just you're a great physical therapist. That's what I'm trying to say. But the squats, oh my god, something has to be worked on over there. But yeah, I would definitely look for a physical therapist that has extensive knowledge in lifting, does lifting him or herself.
Mm-hmm.
But but in my situation, I just needed something that was compatible with my insurance. So
Mm-hmm.
yeah, but yeah, that's basically what I would look for.
Nice. Yeah, because going into the field, I think that's what worries people like the most. Like, what does everyone else look for in a physical therapist? Because like, as much as I might want to do something, it's not useful if no one needs it.
Yeah, yeah. You got to make sure it's with the times, you know.
Mm-hmm.
Treat the patients correctly.
Yep.
But yeah, well, I think I took off enough of your time. That was a great podcast. A lot of great discussions. It's been a pleasure having you on.
Thank you. It was a pleasure talking to you. Also, just this is just like a warning, I guess. I'm still learning, so if anything I said is wrong,
Yeah,
I'm still learning.
disclaimer. She's not a pro yet, guys. So
Yeah.
yeah. All right. Signing out, guys. Peace.